everyone, how are you? I'll wait till we get connected to you guys. It's a pleasure seeing you guys again after 2 weeks on live Instagram session with Doctor. Hello everyone, thank you for joining us today. Thank you everyone for joining us today, and we are going live with a wonderful doctor. Her name is Dr. Kasey Holland, and she is amazing. She is a naturopathic doctor who has dedicated herself answers to chronic illness. And let's learn a little more about naturopathic and how it can help us manage MS and its symptoms. MS is, of course, a difficult disease, and some of you are dependent on lifestyle medicines, on homeopathy, on Ayurvedic, or some people are on allopathy, on DMTs. So let's learn a little more about naturopathy in approach and how to cope MS with naturopathy medicines. So let's invite Dr. Holland right now, and let's see what she has to say about naturopathy approach and MS. Okay, I've sent an invitation to Dr. Kasey Holland, and let's wait for her. In the meantime, if you have any questions, you can of course question me here. And yeah, while the interview is going on, you can of course write your questions, and we'll try to answer your questions as much as we can. So I've sent a request to Dr. Kasey Holland, and let's see. Okay, I think she's here, but I'm not able to connect to her. Okay, let me try joining her once again. Yes, she's here. All right. Give me a moment. Thank you guys for joining in. And if you have any questions regarding naturopathy approach and MS management, please write me your questions. Thank you so much. You love my podcast. Thank you. Oh yes, doctor, I have accepted your request, but I'm not able to see you here. Can we just try again? I'm trying to send you a request, but it's just not going. Guys, again, I'm sorry. There's some technical difficulty. Doctor is trying to join, but we are not able to see her on the screen. Give us a moment, please. I think...
there we go.
Good morning, finally.
Yeah. Hi, how's it going?
Good. Thank you so much for joining here today. It's noon for you, and you look lovely.
Yeah. Oh, thank you. So do you. Thanks for having me.
Thank you. We have been waiting for your session about naturopathy, and we can see the world is, shifting towards naturopathic approach. And
yes,
there are so many people who want to know about naturopathic approach, and while they are on DMTs or Ayurvedic medicines or other types of medicines. So we wanted a specialist who can tell about naturopathy, and we thought you are the best to help us know about that.
Oh, wonderful. Thank you for having me. Yeah, I think that the world has shifted kind of and realized that we need to get to underlying causes of illnesses and not just, take medications. And MS is tricky because the repercussions of it can be really serious, right? So it's scary. So we want to feel like we have a cure or something right away that can change it. And pharmaceuticals can play a very important role in that, especially in getting more aggressive cases under control. Some people have more mild cases and are alternating between relapse and remission, and others are more aggressive, as I'm sure you know. And so I think, it's the most important thing is understanding that we want to use all of our options, right? And the thing that naturopathic medicine does a really good job of is getting to the root cause of why that inflammation is there.
Right.
Pharmaceuticals and other treatments are trying to stop the inflammation from causing more damage.
Yes.
But naturopathic medicine is going to look for, well, why is that inflammation there? So that even while we're stopping that inflammation, can we stop the cause of that?
Yes, and that's why naturopathic approach focuses more on your lifestyle and what you're eating, how you're exercising, and the other sleep patterns and the other approaches, so that it goes to the root cause. Yes, doctor. So when we talk about naturopathic approach, apart from sleep and exercise and diet, what other factors do you look into while checking the root cause of any illness?
Yeah, so those are all foundational and incredibly important, and we have to have those in place. But when it comes to things like MS, the one thing that we really want to look at is underlying infections and toxins.
Right.
So anything from Epstein-Barr virus to Lyme disease, hidden pathogens that could be disrupting our immune response and causing inflammation, as well as toxins, heavy metals, mycotoxins. And a lot of times it's not just one thing, right? So usually if somebody has mold exposure, they also have EBV reactivated. They may also have dysbiotic bacteria. They may also have parasites. So somebody said to me the other day, they said, well, what is the root cause? And I looked at them and I was like, well, there's root causes. So it may not be one thing. And that's where it gets really overwhelming. And conventional medicine doesn't really have time to even manage that, even if they do know, if your doctor does know how to order those tests. You really need somebody that is going to take the time and understand, okay, when we do this, how we do it, and what that looks like with also your pharmaceutical medications to really make a difference and be aggressive so that we can slow down the disease and prevent further damage.
Okay. So, doctor, when we're talking about toxins, so what kind of toxins do we usually talk about in daily lives that we usually use, and we do not even know that we are using toxins?
Yeah. So really, I mean, just think of the food you eat, the water you drink, the air you breathe, and what you put on your skin. Water is a big one that a lot of times I don't think people realize. I really encourage people to go to ewg.org and put in their zip code and see what's in their water. We're finding more and more glyphosate when we test for it, kind of systemic, and that causes a lot of problems. And glyphosate is everywhere, unfortunately, because we've used it so much. So even if you have gone organic and whatnot, it doesn't mean that you don't have any glyphosate, unfortunately. And the problem with that is that it is so hard on the gastrointestinal tract and where it settles. So that's one that's just very common. Then we have our heavy metals that we think of all the time, like lead, mercury, that are kind of more obvious. So, if you have any mercury fillings or things like that, if you can go organic with food, it's better. And you can also find the Dirty Dozen on EWG, where they have a list of foods that have the most pesticides. So prioritize getting those organic if you can. And then, especially for women, makeup and skincare products, there's just so much stuff in them. And I don't think we realize how much that absorbs directly to our skin. So kind of just think of everything. And that's why it can be really overwhelming. Also, if you're getting your hair dyed or colored, what dye is the hairstylist using? How many toxins are you getting from there? So when you reach that point where your body is showing you signs, like in MS, that things are really dysregulated, we want to decrease that toxin load as much as possible.
Okay. Yeah, so like when we dye our hair and we see that it's written on the label, ammonia free or with ammonia. So all those things actually adds on to the toxins, right?
Yeah.
Yes. So doctor, when we talk about naturopathic approach, they also say that it can reverse chronic illness. So how far is it true about reversing it completely?
Yeah, so this is going to be different case by case. And when we look at autoimmune conditions, we have all these different types of autoimmune conditions, right? We have MS, we have JIA, we have RA, we have all these different ones. And the thing is that at the core of it, there's something driving it. So if we can stop that, can the body go back to normal? Now, once the body starts signaling differently and the immune system is changed, yes, we can stop that inflammation. Yes, we can work at reversing it. But how much the body can go back to where it was beforehand is hard to say, and it's going to be different for everybody. So some people definitely go into remission. With MS, when we have the white matter and the lesions there, are we going to be able to completely eradicate that?
Mm-hmm.
You know, there's things that show that help with healthy neuron regeneration and healing, but there might be some residual damage that we can't completely structurally change once that's happened, but we can prevent further damage. We can work towards staying in remission and reduce that. But again, it's not always a miracle where we just go back to everything operating 100%. Wouldn't that be amazing? If somebody knew how to do that, we would all be really excited.
It would be
a
cure.
Yeah. But it can also, the great thing about naturopathic medicine is that it can be so individualized to support wherever you are on that spectrum. Because the other thing is that you didn't go to bed one night completely healthy and then wake up the next day with MS.
Yeah.
It's a spectrum. It takes time. It's been developing.
Yes.
And unfortunately, a lot of times we don't realize that until we get an MRI and we see the results, and then we realize we're at that point. So people are going to be on different levels of that spectrum, and wherever they are at, we can intervene the best that we can with naturopathic medicine.
All right. So doctor, there's one interesting post which I saw on a page, which was about oxidative stress. Can you tell a little about what is oxidative stress and how does it affect a person with autoimmunity?
Yeah, so oxidative stress is kind of like all the junk that your body has to clean up from toxins and infections. So when your body mounts an immune response, the mitochondria and all your cells are operating differently, and it creates reactive oxygen species. These damaged DNA are more likely to cause things like autoimmunity or cancer. So your body has to clear that up and clean that up. The same thing happens with toxins. So that's why antioxidants are really helpful for cleaning that up, and something that when we're calming inflammation, we also want to have a good idea of what your body's oxidative stress level is, so that as it's healing, fighting infections or whatnot, it can easily clear out that junk.
Okay. So, doctor, I'm seeing a question here on my on this feed. Someone has written that what are the kind of supplements they can have on daily basis?
Yeah, so that's going to kind of vary from person to person, and also with the dosage is going to be really important because there's a lot of supplements out there, but especially with MS, we want to get a therapeutic dosage so that it actually makes a difference. Also with that, it could be dependent on what medications you're taking. So some supplements really interact with the liver, and what happens is it can slow down how quickly your liver processes medication or speed it up. So what could happen is you might need a little bit more or a little bit less medication with a supplement. So that's why we always say, you really want to work with somebody that really understands those interactions and can help. But things that can be helpful for decreasing inflammation are curcumin, resveratrol, boswellia, lots of different things like that. But again, even those are natural anti-inflammatories, right? And they are going to help kind of on the root cause level, but we still have to get down underneath to what toxins are there, what pathogens are there, what's going on with your gastrointestinal tract, because a lot of times with MS, we have a leaky brain, and that stems from a leaky gut. And if we don't address that, even if we're taking all those natural supplements, that's not going to slow that process either.
Yeah. Yeah. So it is said that focus on leaky gut, the gut health issues, all the diseases are actually, starts from your gut. So you have to
Yeah.
take care of your gut. So when we talk,
Mhm.
like you mentioned about leaky brain and leaky gut, so how important or how different I can say is it for people with MS or people without MS? Is there a difference that their guts are more sensitive than the others, or they can have more problems?
It's possible. I would say that it's more rare to have somebody with MS and have them have a really great gut health. Like that just doesn't happen as much.
Yeah.
So while we can't say, well, everybody with MS has leaky gut because we don't have the research or tools to say that, that's definitely somewhere that we look right away to see what's going on there because we know how much those systems are related and dependent on each other.
So I have an interesting follow-up question here. So how can I
Yeah.
tell if I have a leaky gut?
Yeah, so signs of leaky gut can vary. Um, is what the technical term is intestinal permeability, where your enterocyte cells, instead of being nice and tight together, are loose, and nutrients that should be broken down and passed through aren't being absorbed. They're being um, leaked there, and then your immune system is responding. So sometimes people will have brain fog. Sometimes people will have actual reactions where, they might get a skin rash or hives. Some people will have food sensitivities where they just notice that all of a sudden they don't feel good after eating all sorts of different foods. A lot of times if you have a lot of food sensitivities or severe food sensitivities, that can be more of a sign of leaky gut. There are some labs that look at like zonulin levels, which is a marker for
Right.
leaky gut that can be indicative of it, and we can do food sensitivity testing. Now, the
Okay.
thing is that if we do food sensitivity testing, the way that I use it really is to see kind of how many food sensitivities are showing up. If we have 50 food sensitivities showing up, it's like, okay, we've got intestinal permeability, we've got leaky gut going on here. And instead of just restricting you on all those foods and being really strict, we might say, hey, with a food journal, try and avoid the foods that are really causing your symptoms. But then we know, okay, we need to be aggressive in figuring out. But really, again, what's causing the leaky gut? Well, glyphosate causes leaky gut. Oral contraceptives can cause leaky gut. Stress can cause leaky gut. Gram-negative bacteria can cause leaky gut. Viral load, Lyme, mycotoxins, parasites, all of those cause that. So again, if you just do a food sensitivity test or you're just treating leaky gut, but you're not removing those toxins and those pathogens, your gut isn't going to heal. Another thing that we see a lot is candida overgrowth with leaky gut. So we have to get rid of those to actually heal the gut.
Okay. So that's the reason why we need to know the cause. What is causing leaky gut? Exactly.
Yeah.
That's right. So I have another question here by I'm Good Thanks saying, can you please tell us about probiotics?
Yeah, so probiotics are good bacteria that we want in your gut, and they actually help with your immune system functioning more. They help heal the gut. We want them there. The tricky part is what ones do you need, and how do you know which ones you need? And also, are they always a good idea? Sometimes they're not a good idea because some probiotics cause higher levels of histamine, which can actually increase inflammation and increase symptoms. Also, if we have a movement issue with your digestion and you have really slow digestion and you have bloating or you have small intestinal bacterial overgrowth known as SIBO, a lot of times we don't want more bacteria in there because we need to clear things out, get things moving, and then repopulate with healthy bacteria.
Yes.
So stool tests can help with that and seeing what your flora, your microbiome is looking like and what probiotics you need, what you're low in, what you have a lot of, so that you're not just throwing them there.
All right, thank you, doctor. I have a follow-up question about toxins and gut bacteria by Lynn Forty Stamps. She's written, Dr. Holland, which toxins and gut bacteria overgrowths are associated with MS symptoms?
Yeah, I'm sure that there are, different bacteria that are more associated. But when I look at it, I kind of look at like the whole picture. So any toxin or any gram-negative bacteria that's causing inflammation is going to cause leaky gut, which is going to cause more leaky brain, which is going to increase symptoms. So I'm sure in the literature there are some that are more aggressive or more associated. The Clostridia species family of bacteria and things like C. diff and those type of gram-negative bacteria are very associated with autoimmune conditions in general.
Okay, thank you, doctor. I have a question here, not related to gut and toxin, but Kanika has written, what is the likelihood of any MS patient ending up on a wheelchair? Very worried about this, and I have heard too many rumors. Please advise, and also how to prevent this. Patient is in their 30s.
Yeah.
So, yeah.
So it's really going to vary on all the things that we've been talking about and how aggressive it is. If you have something that is quickly progressing, that is less common than the relapse and remitting type, but it is possible. So when it's very progressive, then it's a shorter amount of time. So if you do have something that is very aggressive and we're seeing increased white matter quickly and whatnot, that's all the more reason to be aggressive with understanding what's going on and what pathogens are contributing, because in order to slow that down, we have to remove those.
Right. So I would like to add to this that, Kanika, when we say that the likelihood of MS patient ending up on a wheelchair, like doctor said, it all depends on what kind of MS you have and how does it progress. So, of course, when people say that everyone ends up on a wheelchair, it is not true. It is definitely a rumor. It depends from case to case and the kind of MS you have, the way it progresses. So if you are newly diagnosed, it's really sad, and I'm sorry that you have heard such a rumor. It is, a scary thing that once someone is newly diagnosed and hears such a thing, it can be really shattering. But do not get shattered, do not get sad. There are things to help you. And like doctor is suggesting that remove the toxins and go on naturopathic way and do all the things that help you to improve your health. Do that. Listen to your neurologist as well. So do not be scared. It's not that everybody goes on a wheelchair. It's case to case.
And it is important to listen to your neurologist and kind of, in an ideal situation, have your neurologist and your naturopathic doctor talk, right? So that they can talk about medications, talk about how to optimize them, and have the most aggressive approach as possible, because the faster you can get that under control, the better likelihood that you have of a better prognosis, and then you might not ever have to deal with a wheelchair. So yeah, definitely, I completely agree with what you said.
Thank you, doctor. I'm seeing that someone is asking about bromine and fluorine poisoning effects on MS. Do you think bromine and fluorine poisoning affects MS?
Could you repeat that?
It's a second one from the bottom. Do you think bromine and fluorine poisoning affects MS?
Bromine and what?
Fluorine.
I can't find the question. I see the one about probiotics. I see the one about toxins and gut bacteria. Bromine and fluorine. Oh, those like fluoride poisoning?
It seems so, fluoride. I'm not sure about this.
So fluoride is in a lot of water, and it can affect thyroid function and gastrointestinal health, and so it could be a component of gastrointestinal leaky health, and that's why having a water filter and checking on the ewg.org for what is in your water is a good idea.
Okay. Yes, it was fluoride. Yeah, it's written. Okay, I can see another question by Shamhaj, and he's written: Is the inflammation visible, as in like arthritis, or is it internal, or only found via blood work?
Right. So it could be silent, where you
Yes.
don't really feel it until you might start to exhibit some symptoms, and then you are at the neurologist and you have your MRI, and then you see. But people can have intestinal permeability and leaky gut and not know it, and not really have a lot of symptoms, or have just gotten used to them. Whereas other people might have MS and have extreme joint pain and extreme symptoms, and the inflammation is more visible.
All right. Doctor, I would also like to talk about your one of the post on your Instagram again. It was about socialization. You had written
Mhm.
that socialization can also affect one's inflammation level and how one's body can fight infection. So how does that work?
Yeah, so when we are around community and we feel safe and we're around people that make us feel good, we let off different hormones and we shift into a calmer state. And this augments our immune system. When we're safe, our body will rest, it will digest, it will heal. When we don't feel safe or we feel stressed, the body turns off digestion and healing and focuses on protecting you. So stress from, traffic translates the same way to the body as running from a grizzly bear. So when we have community and we hug someone and we feel good and we feel safe, not only do we get oxytocin, healthy hormones, our immune system stabilizes and becomes less inflamed, and that's healthy. And that's why community and social support is so important when we are healing or dealing with something like MS.
Okay. So yes, so during COVID times, people were not able to meet each other. That's why they were having lots of stress and depression and anxiety, and some people also had a flare up of MS. Maybe that's the reason why.
Absolutely. Yeah. I mean, stress not only does it change that parasympathetic sympathetic response, but it directly affects your gastrointestinal bacteria. So we have studies showing that stress and the catecholamines that are released make gram-negative bacteria more active. So you're actually directly increasing gram-negative bacteria that can cause leaky gut, which then also is going to affect your brain health.
All right. Thank you, doctor. So now I can see when we're talking about socialization and stress, I can see a question about smoking. Because smoking, when we talk about people socializing, they meet together and they smoke tobacco, or when they're in stress, they smoke. So the next question is by Hannah saying, what effect does smoking tobacco have on our MS?
So MS or smoking tobacco is going to cause a lot of reactive oxygen species. I think a lot of times we just think of smoking as, oh, it's bad for your lungs, but it's not just bad for your lungs, it also affects your liver. So it's going to affect how you're able to detoxify. It's going to decrease your body's resilience to oxidative stress overall and make it more susceptible and create a lot of oxidative stress, which is why we kind of see people that have smoked for a really long time. It's almost like you'll hear them say like they feel like they're aging so fast because their body can't keep up with that burden. So it will be an extra burden for your body.
Okay, all right. I have an interesting question by Resin News. He's asked, is it okay to switch from a DMT to naturopathic medicine to treat MS?
Is it okay to what?
To leave the DMT treatment and move to naturopathic approach for treating MS?
So
They,
again, talk with your neurologist and your naturopathic doctor. The best world is where they're working together. If if you talk to both of them and your physician decides like, hey, if you want to leave this and do this, this is the possible benefits and risks, and you feel good about that, then that's great. But that needs to be a decision that's made with talking to both of them and understanding what that could cause in terms of changes in progression or mission and things like that. And so we definitely want to use the best of both worlds to get you the best of results as possible.
Yes, so everybody who's listening and wants to move to naturopathy, you have to speak to your neurologist first, and then probably if you get confident about it and the doctor also recommends, of course you can switch your treatment to naturopathy or a treatment that suits your body, because everything is like person to person. It's quite personalized. Okay.
Yeah, and a lot of times is what you could do. So sometimes at first we need to be really aggressive with pharmaceuticals to get inflammation under control, and we can bring on naturopathic therapies as well and get to the root cause while we're using that. And then when we have that under control, you might need less and less medication, so they can work together.
Okay. So I have a follow-up question after the smoking. Someone has asked about alcohol. How does that affect someone's MS?
Yeah, it's the same as smoking because it's going to be increased oxidative stress, stress on your liver. It also really does affect just how you feel emotionally, and it's really hard on your gastrointestinal health too. So it's going to kind of do the same thing and definitely be an added burden.
Okay. Doctor, we've been speaking for half an hour. We'll just go for 10-15 minutes more, and then we can, in the meantime, we'll just take as many questions as we can. Thank you.
Sounds good.
I can see a question about cold plunges. Is it really worth it? And how many days a week one should try it?
Yeah, so cold plunges are really helpful for increasing circulation, for activating your immune system, but being modulatory with it and putting you in a parasympathetic state. So the key to a cold plunge is that you want to breathe calmly and deeply to activate your parasympathetic state while you do it, so that you're building nervous system resilience. And really, I think the best thing to do is just work it into your daily routine of, if you don't have a tub that you can do cold plunges in and that's too much, you can also just end a shower on cold or something like that. But a lot of things like this, they're not going to work just after a week of it. It's incorporating that into your lifestyle, and now it's been 6 months and you are operating on a more calm and grounded state because your nervous system is operating better and pathways have started to change. And so it's definitely a good lifestyle practice that has benefits.
Okay. So doctor, when talking to you, I just wanted to know about COVID. So how have you personally dealt with the COVID outside, when people were scared and they were having lots of vitamin C and zinc? It was said that, once you have vitamin C and zinc, you will not have COVID. Were you following such things, and how did you cope with it?
Yeah, so my approach with every person is to look at their health and see where their weakest systems are and what we need to do to get them as resilient as possible. There's nothing that completely makes us not get the coronavirus. I had it, so there's nothing that we can do to completely not get it, and it is an infection that really, people that have a history of gastrointestinal health issues, a lot of times when they get it, they'll have more GI symptoms. People that have a history of something else, it displays differently, or they might have a more severe respiratory case. So my goal is to just make each person as strong as they can be. And that way, whether it's COVID or any other infection, they are as resilient as possible for that infection. Things like vitamin C, zinc, vitamin D, all of those things are foundational and very helpful for healthy immune response and making us stronger, especially vitamin D. I mean, there's so much in the research about how important those levels are, especially with MS.
Yes.
But unfortunately, there's no, hey, if you do this, you won't get it. So my goal is to just help each person to be as strong as they possibly can.
Which is very right. Yes, you have to be strong within yourself. It's not that something can just stop, getting that infection if it has to be, you can't help it. But you have to be strong internally so that you can fight with the infection. So for that, probably if you need some supplements, why not? And in fact, with MS, people I'm sure are already taking lots of supplements. Like, for example, so people are taking vitamin D, they are taking biotin, vitamin C. These are the common supplements which everyone is taking. Flaxseed oil. All these things people are already taking, and there's nothing to fear when it comes to COVID. Just be strong in your mind. All I can say that, it's more of a mental trauma because of the media and what people are talking around us than it is an actual disease, an infection. Infection is scary, but if you are strong in your mind, you can fight COVID as well. So you have to be positive when it's MS or COVID. Everything, everything boils down to one thing: your strong mind and positivity. That's what is important. Okay. Doctor, I can see a question by Kanika, who's saying that how can someone find a right balance between exercising and not overdoing it and not causing damage?
Yeah, exercise is really important, and muscle also can help decrease inflammation levels. So I typically suggest people work with a strength coach and work on strength building more so than just running. So just running and just cardio can actually decrease our secretory IgA levels in our gastrointestinal tract and actually be kind of damaging to our immune system and our adrenals and all of that. So it's really important to be getting strong and building muscle and working with a strength coach that can help you understand how quickly your body recovers, how much time you need between that, and really tailor it so that you are feeling like you're getting stronger and you're not overdoing it and then feeling sick for a week afterwards or whatnot.
Right. So you have to manage your own strength level so that it doesn't turn into fatigue later on. Absolutely. So doctor, I am going to now ask you one question which is very common and I'm sure everybody must be asking you. What diet would you recommend for a person with autoimmune disease like MS? Some people say follow Terry Wall's diet. Some people say keto diet. Some people say just avoid gluten and dairy and rest is fine. So what's your opinion on that?
So first I just start with, it needs to be whole foods and get everything as close to from the earth as possible and as clean. So having clean meat sources is really important. I really like the Terry Wall's approach. And I think the reason that she has seen so much success and helps so many people is really what she's doing is increasing antioxidants. And so I think having the big things is a lot of vegetables, healthy meats. If you are vegan or vegetarian, having healthy sources of where you're getting your proteins and not just replacing that with carbs, and then decreasing carbs and sugar and processed foods. That's the biggest thing. From there, then we can tailor it more towards you. For example, if we're healing your gut, or if you have food sensitivities, or you have SIBO as well, because with SIBO, a lot of times people can't do vegetables, so you might need to be cooking all your vegetables or things like that. But that's kind of the foundational things that we see are things that are going to be giving the body antioxidants and giving the body nutrients to repair, and foods that do not have toxins, so you're not increasing your oxidative stress load.
Okay, thank you, doctor. Doctor, I'll just take the last question I have here. And the question is by Jacinda, and she's written, Hi, doctor. I have recently experienced weakness, numbness, and pain in my hands and fingers. I'm not able to do any exercises with weight like I used to. What do you recommend for this?
Um, well, to definitely talk with your provider and get, a coach or someone. If you are able to do things like yoga or whatnot, that can be helpful for strengthening the parasympathetic tone as well as the immune reservoir as well. But really, again, we would be wanting to know, what we can do underneath to that, and definitely don't push yourself when you're at that point, and explore options, get answers, ask questions, and really dig deep so that we can get you on a path to recovery.
Absolutely. Thank you, doctor. Thank you so much for this wonderful session today. And thank you so much for your great time. You have really given us 45 minutes of your time today. Thank you so much. And this was really, really informative. And you've answered so many questions from the audience. I'm sorry I'm not able to take all the questions today, but we can do this session later on sometime with Dr. Kasey. But all I can say is people just love and adore you. And they all are thanking you for this incredible session today.
Oh, thank you so much for having me. And all of you, just never stop advocating for your health.
Thank you so much. You are just so kind and so inspiring. Thank you so much, Doctor, for your time. And everybody, please follow Dr. Kasey Holland on Instagram. And you can also visit her website. And if you need anything, you can, of course, message us and we'll help you, connect to her. And you can message Dr. Kasey directly if she doesn't mind.
Thank you.
Okay, I've got a message followed. All right. Thank you so much, doctor. Have a good day.
You too. Bye-bye.
Thank you. Thank you so much, everyone, for joining us today. Dr. Kasey is definitely so incredible, and she has helped us answer so many questions regarding MS and toxins and gut and whatnot. So you guys keep smiling, and like she said, be positive and keep advocating. So stay positive and take care. We'll be again doing another session with another doctor sometime soon. Thank you so much. We'll keep you informed. Bye-bye. Thank you.